I've been with the University of Utah for 33 years, count them, 33 years, believe it or not, and all with the communication department.
I am the program director here for social work and also professor of psychology.
Although I grew up mostly in Utah, I also grew up in Denver, Colorado.
I was born in India and worked for a couple of years, then moved over to Utah about 8 years ago with my family, and have been at the Division of Public Health at the University of Utah ever since.
I'm Jay Jordan. I am an associate professor in 2 departments at the University of Utah. I'm in the Department of English and in the Department of Writing and Rhetoric Studies.
I've lived in Utah teaching at the university for about 25 years.
I was born in Richmond, Virginia, but my family moved when I was very young to Fayetteville, North Carolina, which is in the eastern part of the state, near Fort Bragg, which is a really big Army installation. I grew up actually around quite a few Korean Americans because GIs from the United States, soldiers, had married Koreans when they were in the Korean War in the 1950s, and then those families moved back to the States. And there were a number of those families in my area.
I grew up in Louisiana. I was born in St. Landry Parish in Opelousas, a small town in South Louisiana. And traveled around, lived in Latin America a lot, and settled in Utah, where I've been for the last 25 years or so.
When I first graduated, my first career, I was a hospital CEO. I worked in hospital administration for 14 years. And then I have been a professor, went back for a doctoral degree and became a professor after that.
My research focus is global women's issues, and that entails health issues and other kinds of situations where women are marginalized and disempowered.
My specialties include mostly things like sports broadcasting, journalism as well, and also visual communication.
I work for the division in global health, and my focus is on maternal and child health. And I've worked in nutrition, I've worked in the implications of water, sanitation and hygiene, how it affects the maternal and child health in developing countries.
And I've also worked for 10 or 15 years with marketing students as a writing consultant and advisor.
I've met interesting people, I've met faculty, I've met students who work across borders, and they bring to me a very rich and diverse experience. I mean, I've learned a lot from their experiences, and then, have been able to reframe my approach to global health.
I lived in North Carolina until I finished university, and then traveled abroad to Poland to teach as a U.S. Peace Corps volunteer, and then came back to the United States, went to graduate school at Penn State University, where I completed a PhD in English with an emphasis in rhetoric and composition.
I was the clinical director of the Heartland Partnership Center, which is a community-based center that the University of Utah runs to assist refugees in the Salt Lake area.
I managed the TV studio like the one you see here, and all of the facilities in the Department of Communication that included computer labs and instructional spaces.
I also engage myself in directing a global summer learning abroad program where we take students from the U, undergrad and grad, and of course students from outside the U also, to countries like Peru, Armenia, Ghana, and India for a dedicated 4 weeks program during the summer break. So I have done that over 4 years now, where I have taken about 30 U of U students to India.
I've loved working here at University of Utah Asia campus, and I have to say it's the students and my fellow faculty members that make it so enjoyable. The students are so excited and motivated, and the faculty members have been wonderful to coordinate and work and support each other. It's been a wonderful experience.